Hi friends, welcome back to allornonelaw. Today I'm going to talk about a behavioral science topic or statistical topic for USMLE examination, that's differentiating observational studies like cross-sectional studies, case control studies, cross-sectional studies, case control studies and cohort studies. Okay? So I'm going to differentiate like the characteristics of different types of studies like time, incidence, prevalence, casualties, causality, role of disease, assesses, and data analysis. This is a really very important topic for USMLE examination. So now let's talk about this. Before starting a discussion on these studies, I would request you to subscribe to our channel. That's all on law, and please do not forget to share our videos with your friends. So let's start with this. First, the characteristics. I'm going to talk about the time. Okay, the time in the cross-sectional studies is one time point. Okay, whereas in a case control studies it's a retrospective case to control, so retrospective. Whereas in cohort it's prospective. Okay, we are moving ahead, cohort studies. Whereas in cross-sectional we are cutting across, we take a knife, hit it, we are doing at that time, at that point, so one time point. Case control, we are running backwards, we are comparing with the controls. Whereas the cohort studies we are giving now and we are seeing after 10 years, 20 years, so it's a cohort prospective studies. Okay, the incidence in a cross-sectional studies, it doesn't have any incidence. No. Case control, we cannot find the incidence. No. Whereas in a cohort study we can find out what you call incidence, so it's a S. Okay, prevalence, we are able to find the prevalence in cross-section studies. Okay, cross-section studies, whereas in case control studies we are not able to find prevalence. Remember, very important for USMLE examination, they will ask you, definitely they will ask you a question on the incidence and the prevalence on these studies. Okay, whereas in a cohort studies you are not able to find what you call able to count or able to find the prevalence in cohort studies. Okay, what are the causality? Okay, causality is, we are not able to find the causality in what you call cross-section studies, but we are able to do that in case control studies, and in cohort studies we can able to do that, right? Now, role of disease I'm going to talk about. What's the role of disease? Role of disease in a cross-sectional studies is a prevalence of the disease. Okay, it's a prevalence of the disease. In a case control, begins with the disease. It begins with the disease. Okay, whereas in cohort studies it ends with the disease. The role of disease in a cross-section studies will be prevalence of the disease. Okay, whereas in case control it begins with the disease, and in what you call cohort studies it ends with the disease. Okay, now let's move on to the other data analysis in cross-sectional, case control and cohort. Okay, the data analysis, so what kind of data is used to analyze the studies in cross-sectional, can you say, is chi-square. Remember, chi-square. Whereas in case control studies we have odds ratio or estimate risk. Odds ratio or estimate risk. Whereas in cohort we have relative risk to what you call estimate risk. Whereas in case control, odd ratio to estimate risk. In cohort study, relative risk to estimate risk. Okay, the assesses, not assesses. Okay, assesses, association of the risk factor and the disease. Here in case control studies, in cross-section studies, you see associations of risk factors and the disease. There is association. Whereas in case control studies, many risk factors for the single disease. Many risk factors for single disease. Many risk factors. Okay, more risk factors. Okay. Whereas in a cohort studies, single risk factor for affecting many diseases. Single risk factor for very many diseases. Because for example, if you want to study a cohort study on what happens if you give if you allow a patient to smoke and you just leave it for 10 years smoke, then you come with a cohort study that smoking causes lung cancer, some studies say smoking causes pancreatic cancer, some says smoking causes increase the risk of what you call CAD. Okay, so these are the things. So single risk factor but multiple diseases. That's why we see in the cohort studies, whereas in case control studies it's multiple risk factors giving a single disease. Okay, so hope guys this is useful for you. Thank you so much for watching this video. Take care. See you soon in the next amazing awesome video with us on all or none law.